Well, hi there. It's Christopher Westfall here, and I want to tell you some news about Medicare. And this is kind of a little bit distasteful in that we've been talking about this for the last 2 years. As a matter of fact, I did an interview with a local television station, a CBS affiliate here in our hometown of Charleston, South Carolina, talking about this very thing about Medicare fraud and how it's so blatant. We all know it's happening, and yet it continues to happen. It continues to be allowed to happen. And what we can do as taxpayers, as it seems like our government has no end in sight to the spending that they're just going to throw out there and raise inflation and everything else, what can we do to stop the fraud from benefiting those people who would like to take advantage of our Medicare system that we as employees and employers, in my case, are paying into every single month, and the beneficiaries are hoping to reap the rewards of which they've paid into their entire lives. So what's going on today just came out from the Department of Justice. I want you to be updated as to what's happening here, and I'll show you where I covered this very thing 2 years ago. It's kind of disheartening, to say the least. The Justice Department has just announced criminal charges yesterday, against more than a dozen people from Florida to California in a series of Medicare scams. Nothing new there. That exploited coronavirus fears to build tens of millions of dollars in bogus claims. Now, what I'm going to cover in just a minute is how you can avoid being a victim of this type of fraud, because the worst that can happen is they're billing Medicare for this through some organization. Medicare denies the claim, then they may sell off that bill to a collection agency and come after you if they've been able to gather your personal information. That's what we're going to talk about today, how to spot fraud, how to identify it, report it, and not be a victim of it. The story goes on. A common hook involved a pandemic variant of identity theft. I've been talking about identity theft for, let's say 25 years. Let's see here. Here's a news story from, I think this is WFTV, Channel 9 in Orlando. I'm dating myself here. 20 years ago. Check this out. This is when I was back doing crime prevention. I was a crime prevention practitioner with the sheriff's office back then. And this is just okay, you'll see how long ago this is.
The Volusia County Sheriff's Office held an internet safety forum for...
Would you look at that right there? Wow.
Starts at home. Parents need to monitor their children's internet activities and keep the computer in a main part of the house.
That was quite some time ago. So I've been knowing about identity theft and trying to educate the public about this for over 20 years. That was a long, long time ago. That was the younger version of Chris Westfall, the sergeant. So this particular one is just another variation of identity theft. Identity thieves cannot succeed unless they have a victim that falls prey to giving out their information. So that's what we're going to talk about. These schemes, the one from yesterday, we constantly see them evolve to another level, says Chris Shank, Assistant Inspector General for Investigations with the Department of Health and Human Services. And that's these folks right here. At a time when most Americans pulled together, a small percentage of individuals have decided to steal from programs valuable to those who are in most need. And that's everyone that was going through the pandemic. The law enforcement actions today involve the Justice Department's Criminal Division, the FBI, 7 U.S. attorneys' offices in 6 states, as well as the HHS Inspector General's office and other agencies. Bogus billings have exceeded now $140 million before the schemes were blocked. That's just these particular ones that they caught. The Attorney General, the new one, Merrick Garland, recently announced the establishment of a new special task force to pursue pandemic-related fraud. So I just want to share with you a couple of these things that have just come to light. Wednesday's charges look back at the early months of the pandemic when there was such a high demand for COVID tests that were still in short supply. Medicare had loosened its restrictive policies on telemedicine consultations. And of course, anytime a policy is loosened, people are going to take advantage of it. There's a couple of things that happened. Among those charged, Michael Stein and 𝐬𝐭𝐮𝐝𝐿 Palatnik of Palm Beach County, Florida. It's amazing how many Medicare fraud phone rooms and scams originate in the state of Florida. I'm not saying these people are guilty. They're innocent until proven guilty in a court of law. These people were just charged in connection with a $73 million conspiracy to defraud the government and pay and receive kickbacks. $73 million just since the pandemic started. Stein owns a consulting company. Palatnik owns a Texas company that in turn owned and operated testing labs in Dallas and elsewhere. Federal prosecutors allege that Medicare recipients for whom they could bill consultations in exchange for information, the clinicians would also refer patients to labs owned by Palatnik's company for costly and unneeded genetic tests for cancer. If you've been a subscriber of this channel, if you're not, I strongly suggest that you subscribe and tell everyone that's on Medicare or soon will be on Medicare that they should subscribe. I've been talking about this for a couple of years, the genetic test for cancer scam on Medicare. And enough people fell for this that they got the Medicare numbers and they were able to bill Medicare. And here's where I covered this the last time. I'll just show a small piece of this, but it's important that you see this.
That's always been a problem. Somebody calling, offering something for free, and then the senior divulging their private information, which they never should do unless they can verify who they're talking to. The second problem...
Christopher Westphal is a Medicare specialist in North Charleston. Through his agency, the Senior Savings Network, Westphal has videos online.
Hi, it's Chris Westphal. I'm a licensed insurance broker
To help seniors across the country with Medicare insurance needs.
We have clients in 46 states, and if there's kind of a senior scam, we're going to get a phone call about it.
Medicare does now pay for some genetic testing when it's medically necessary and ordered by a doctor. Scams involving genetic testing have become so rampant, the Department of Health and Human Services put out a fraud alert.
Rather than just relying on someone on the phone telling them that this is good for them or this is free, which really should raise a red flag, they should ask their primary care physician if it's even something that they're even eligible for or necessary in their case.
The HHS fraud alert includes a hotline and a link to report any suspected Medicare fraud. Now, I've included that in...
The story continues. Fraud against government health care programs is a pervasive problem that costs taxpayers billions of dollars a year. That's what we're talking about. It costs taxpayers tons of money, and that's why we want to prevent this. The true extent is really unknown. Experts say that part of the problem is that Medicare is required to pay medical bills promptly, which means money often goes out before potential fraud gets flagged. Investigators call this pay and chase. In recent years, Medicare has tried to adapt techniques by using credit card companies to head off fraud. Law enforcement coordination has grown with strike forces of federal prosecutors and agents, along with state counterparts who specialize in healthcare fraud. Wednesday's charges come a little more than a week after Attorney General Garland ordered the establishment of a special task force dedicated to countering COVID-19 fraud. The department has brought several cases in recent months of this. So we've known about this genetic testing fraud for a couple of years, and yet there's been no real enforcement. Now there finally is, and I'm glad to say that. The Attorney General's office says the multiple healthcare fraud schemes charged today, that's yesterday, describe theft from American taxpayers through the exploitation of the national emergency. We are determined to hold those who exploit such programs accountable to the fullest extent of the law. So in this particular picture here, you can see this is literally the picture from the scene yesterday. It says, in this image provided by the Department of Health and Human Services, federal agents from DHS, Office of Inspector General. Now, these are the same people that did that Medicare Advantage study, you'll recall, about Medicare Advantage, the appeals, that 75% of all the appeals with Medicare Advantage are overturned. It's these folks that really look into that stuff, and they're also looking out for us and protecting our Medicare dollars, which is good. This is when they engaged in the search warrant yesterday at the laboratory in Atlanta. More than 35 individuals associated with telemedicine companies and cancer genetic testing laboratories were finally charged for actions related to fraudulent genetic testing. The Justice Department announced charges on May 26 against more than a dozen people in this particular case. So in this particular thing here, what can you do to prevent yourself, your Social Security number, your Medicare number from being used in a fraud that will not only defraud you, but also Medicare in general? A couple of things you can do, and there's my story. Before we get to that, if you've not yet done so, please do me a favor. If you find any value in this or other content that I've promoted, please hit the thumbs up button. It really helps with the YouTube algorithm. And if you've not yet subscribed to our channel, which is all about Medicare and how to benefit you from the Medicare program, please subscribe to the channel and tell somebody who's coming on to Medicare or already on Medicare about the channel. We just broke over the 30,000 subscriber mark, over 3.5 million views since we started the channel. And I want to thank you for being a regular watcher. Back to the story. According to Medicare, what you can do is not putting your list on, this is already almost over with, as people have whoever's going to get the vaccine has gotten the vaccine, but certain websites were trolling for information so that you could go to the website, sign up, put your name on the list so that you can get the vaccine. Hopefully that's all done away with now, as most people who have sought the vaccine have already received it. That's great. But no one should be charging you for the COVID vaccine. It's always been free from the very first thing that Trump signed when the first thing started. That's all free. You should not be asked for your number to pay for it. It says right here on the Medicare site, con artists may, you can't see that, now you can, con artists may try to get your Medicare number or personal information so they can steal your identity and commit Medicare fraud. Medicare fraud results in higher healthcare costs and taxes for everyone. Guard your Medicare number, your Medicare card. And yes, I know the whole thing is they changed the Medicare card number. It's no longer your social security number. Thank God. Now it's a unique identifier number, but all they need to do is trick you in some way to make you think that it's Medicare calling for it. And here's the most important part. Medicare will never call you and ask you for your Medicare number. If someone does, listen, it's just me to you. I know they happen to be in Florida, just a complete coincidence, but I know of Medicare call centers who do insurance, Medicare insurance like we do, who have literally called seniors with the robocall. They'll call them, get them on the phone and say, I'm with Medicare, and it's time to review your Medicare insurance. You need to go get your Medicare card to make sure that we've got the right number and I'm talking to the right person. And very sadly, seniors will fall for it. These insurance agents will literally say that they are with Medicare. And it's really a shame that they do, because there will always be somebody that falls for it, right? And that's why they continue to do it. If it did not pay, if it did not work, they would not continue to do it. So it's important to spread the message for everybody on Medicare. Medicare will not be calling you to ask you for your Medicare number. It's not something that's done. If someone is calling you asking for your Medicare number, it might be an insurance agent. That doesn't even mean they're legitimate. What if it is an insurance agent? Why don't you verify who they are? Write down their name, write down their license number, and then call the Department of Insurance to see if it verifies with them. The address, the phone number, everything should verify, and you should be able to call them back. You know, sometimes I've heard this, when the president calls somebody, no matter who it is in office, they will give a number to the White House that you can confirm, the 202 number in Washington at the White House. You have to call that number back. That way you confirm it's really them. And then they put you right through to the president. Why is that? Because you can fake caller ID. That happens all the time too, and seniors don't know it. So you could put in your little computer or your phone or a spoofing app that's available for free, literally online. One's called Spoof Card. You can put in your caller ID. I can make it look like I'm calling from HHS. I can make it look like I'm calling from the YMCA or from Medicare or from Social Security. And imagine if you're an unsuspecting senior who lives alone, you haven't spoken with somebody or been out of the house maybe for months. You get a phone call and it shows up on your caller ID as Social Security Administration, Washington, D.C. And so you're more inclined than ever to just give the information that they're asking for. Please don't do it. Call them back, ask for a name and extension, and then make sure the phone number is the real thing, the real deal, and call them back. Medicare will never call you to sell you anything. Medicare does not call you to sell you insurance, ever, or to get you to change your plan or check on your plan. God bless them, but they don't have the time to do that. And even if they did, they don't care if you're on the right plan or not. You're on the plan that you chose on your own. And hopefully you had the guidance and the wherewithal to go through an agent that cares about you enough to take the time to look into it for you and handle that for you. But Medicare will never call you. And I'm trying to head off these call centers that do this horrible practice of literally calling seniors and saying that they're with Medicare. It literally is going on right now. And then you may get calls from people promising you things if you give them your Medicare number. This used to happen all the time with seniors getting calls about durable medical equipment. Do you have diabetes? Did you know, in fact, you can get a list of people that have diabetes? I don't know how they get it, but these people get it, list brokers. And they can get a list of your name if you're a diabetic, for instance, and call you and say, did you know with Medicare, you can get free diabetic shoes? You can get free compression socks. You can get all these free things from Medicare. That is not legitimate. And even if it were, would you want to deal with somebody who had nothing better to do than sit there and just call you all day on the phone? Would indicate to me maybe you're not dealing with a professional. I digress. Medicare will never visit you at your home. Medicare cannot enroll you over the phone unless you called first. That's critical. See, we enjoy a certain level of success in my agency, thank God, and I'm thankful every day, and I literally do thank God every day for it. But we have people that call us for help, and that's a very big difference. It's kind of nice when you know that you can pick up the phone and you, the consumer, are in 100% control over who you get to do business with. Nobody from my office, and we've had hundreds of agents over the years try to use our name to call seniors and say, hi, I'm with Chris Westfall's office on the Senior Savings Network. Maybe they know that we've had millions of viewers. I don't know. But nobody from my office has ever made an outbound call to try to sell anybody anything, and we never will. Medicare can't enroll you by calling you on the phone. That's another thing that we in detective work used to call a clue. If they called you, they're not with Original Medicare. Yes, they could be a legitimate agent, but the burden of proof is on you. It's on them to prove who they are first. So the other thing that you can do is regularly review your EOB. That's your explanation of benefits with Medicare. You need to look at that very closely and see, did you in fact receive all of those services? If you didn't, that too is a clue that you should check out. You can call Medicare. A lot of people don't know this. You can call Medicare 24 hours a day, and they can pull up your claim and explain to you what that claim is. Any time of the day. If you're a night owl up at 1 o'clock in the morning, call Medicare. They'll go through your EOB with you, and you can see what it is, if it's legitimate or not. But the minute that you suspect fraud, you need to let somebody know. And I would start with letting Medicare know. Now, I put their phone number on here to make it a little bit clearer. You probably should write this down if you don't have it already. Now, how many people have the rotary phones or the old push button phones where it still has the letters A, B, C, D, E, F, and all that? If you're using that and you can identify where that is on your phone still, you can just call 1-800 and spell out 1-800-MEDICARE. If not, we've kind of committed this to memory over the years. It's 800-633-4227. If you need to ask about your Medicare, ask about your benefits with Medicare, ask about a charge that you think is suspicious, ask which supplement am I on? They should be able to see that. Which Part D plan am I on? They should be able to see that. So that's what you should do, is call Medicare. Don't wait for them to call you. And if they do call you suspiciously, if you think it is something weird, then say, you know what? I don't do business over the phone like this. I'm going to initiate my own outbound call. I'm going to call you if you're Medicare. What's the extension I should ask for when I call there? That alone will head off probably 99.9% of fraud. Just be very skeptical of what you hear. What is it the old saying says? Believe half of what you see and none of what you hear. So I bring this information to you in the news for one reason. I don't want seniors to be taken advantage of. I never have. When I became a police officer at the age of 19, when I wanted to be a police officer at the age of 5, my goal in life has always been to try to protect people, the victims, from the victimizers. And one thing that we have to do as adults, as citizens of this great country, is we have to take our own accountability for our personal information. Be very careful when you fill out a form online. Even if you think you know the person on the website, just be careful. Look at the top of the website address in your address bar on your website or on your phone or on your browser, and make sure it's secured with a padlock to make sure that any information that you submit online is being done so securely. So you're not just putting it into some fraud site somewhere. And just be careful the information that you give out. You're always in control when you dial out. So when you are reaching out to somebody else, that's great. If they've reached out to you, please raise the threshold upon which you won't do any information or give any business out at all about you until they verify who they are, tell you all the information, and then you call the legitimate number. And you can look it up online. The good thing about doing business with an insurance agent is all of our information is public. We've had background checks by, in our case, over 40 different states and the FBI, and the departments of insurance have looked into our background to make sure that we're not scammers. And we have to recertify every 2 years. We have to do more continuing education. The background checks are ongoing. They have our fingerprints on file. And the reason why I say that is you need to have a trusted advisor that guides you through this process. And if you don't, or you can't find your agent, which is happening so often now, see, our industry is one of aging agents. The majority of our industry is agents that are over the age of 55. So they're retiring. They're going to do other things and hopefully one day start cruising around the world again. If you've lost your agent, you don't have somebody that's accountable to you, I encourage you to find somebody that you can trust. And again, you reaching out to them puts you in complete control. We are just one of many agents that are out there that you can trust. But again, I encourage you to check us out. We've got over 520 five-star reviews on Google, reviews all over the internet about what we've been doing over the last 26 years now that I've been licensed. You can see our history on our website. Do a little bit more of a thorough investigation so that you don't become a victim of fraud, which does not only affect you, and hopefully that can be repaired and remedied in your particular case to make you whole again, but it takes your time and it makes you feel vulnerable. And it also affects those that get away with it, all of us that have paid into the Medicare system. So I'm here to help in any way that I can. My name is Christopher Westfall. I'm a Medicare agent, and we do business from coast to coast. If you need another opinion about your Medicare plan, or you know someone that's coming into Medicare, my office is a whole bunch of nice people. Look, you can see them in that picture right there. Great people who can help you. We all have background checks on file, done all the time by the departments of insurance. We know what we're talking about. We specialize in Medicare. We don't sell 500 different things. We want to stay in our lane, and that is to be experts on one topic and one topic only, because Medicare is big enough and it's more specific enough that we should be experts on this one topic, not try to be a jack of all trades and do everything. So if we can help you in any way, please reach out and let us know. Thanks for watching today. And if you know anybody that's on Medicare, please share this with them so that they have the tools and they're armed with information so they don't get scammed and affect us all in Medicare. Thank you so much for watching. God bless you. Have a great day. That's all I got, really. Oh, you want to see that old story?
Tonight, the Volusia County Sheriff's Office held an Internet safety forum for parents. Internet meeting sites have become a virtual bonanza for child predators. Those predators are now using the anonymity of their keyboards to troll for their next victims. Law enforcement agencies are having a tough time combating these online predators, but they say prevention starts at home.
Obviously, but somebody else may be invading their childhood.
Deputies say parents need to monitor their children's internet activities and keep the computer in a main part of the house.